This conference will now be recorded.
All right, y'all. So thank you so much for being with us this afternoon. I know it can be hard, especially on a Monday afternoon of all days. That was a little cruel. We picked that time, but we're glad that you could be here with us. I think most of you on the call know me, but just in case, I'm Sarah Murray. I am the SOAR state lead, and Sumitra Pokato is also with us. She is our liaison from SOAR National. Just to give you a little bit of a roadmap, I'll spend just like 10 minutes giving us a little bit of context about why we're here today and why we're transitioning over to OAT. And then Sumitra will take it over and really give us kind of the run through of the OAT system. We planned it so that we should have plenty of time for questions and any comments. So feel free to put things in the chat or ask questions out loud. I think having seen Sumitra present before, I know she's also a pretty informal presenter, so just chime in whenever you need to. So if you're here, hopefully you know about our plans, our state's plan to transition to OAT. I wanted to start off by giving a little bit of context for those of you who have submitted outcomes before and those of you who have not. Let's talk a little bit about what the current system is in North Carolina. Currently, we are one of only 2 states that does not use the OAT reporting system. And over the last year, Mecklenburg County has been very gracious and generous and has participated in a year-long pilot of using OAT so we could see how it would work in our state. And so far, so good. As with anything, there are pros and cons that we'll kind of get to. But we decided that it was finally really time to not be one of 2 states that were the holdouts here. So currently, SOAR case managers use either fax, they can email me a Word document, or they submit through our NCCH website. I then take all of that data and put it into an Excel sheet, and I create monthly reports that I post on our website, and I also create reports for individuals whenever they request that of me. Under the OAT system, the data will now live on a secure server. So it won't just be kind of on my desktop in a big giant Excel sheet with 13 years worth of data. It will be in a national database that multiple people can access. I will still publish monthly reports the way that I have been doing and put them on the website so that you all have access to those. But in addition, you will have your own login to the database system, and you'll be able to run your own reports on your own data, so you won't have to wait for me if you want information about your own cases. In addition, if any of you on this call are supervisors or agency leads or local leads, I see we have a few of my local leads on here, you all will also be able to see the outcomes from your region or from your agency. And again, you won't have to wait for me to run a report on that. You'll be able to do that instantaneously, and it has some really nice visuals there. So the plan is, as of July 1st, 2021, which is the beginning of our fiscal year, all SOAR case managers are going to start submitting outcomes through this database rather than the old system that we just went over, fax, email, or through the website. Everything will go through this database. And it's okay if you forget. It's okay if you mess up and you send it in the old way, but you'll get an email back from me saying, hey, just remember, you really need to submit these through OAT. I can't accept it this way anymore. So that's why this month and next month, we're kind of gearing up and learning how to use the system. So as I said, I wanted to just have a really honest evaluation. I think for those of you who have been in dialogue calls, we've had a lot of these discussions and you know kind of the pros and cons of the system, but I wanted you all, for transparency's sake, to really understand why those of us who have been on the dialogue calls and in local lead calls have decided to move forward with the OAT system. So first, some of the cons. There isn't a way to enter your past data. So if you're somebody who has been submitting outcomes to me, I still have them in my spreadsheet and they will exist forever and ever, and you will have credit for them. And in my monthly reports that I do, I will make sure to have your old outcomes in our monthly reports. But in the OAT system itself, we don't have a way to enter in those old outcomes. So we'll only be outcomes moving forward from July 1st onward. Also, the OAT system, as you'll find out from Sumitra when she does the run through, it does require you to actually log in, right? And so remembering that login, changing your password, I think it's like every 90 days or something like that, having to register for it, that's a little bit different than just sending a fax or an email. Just, change is hard. Learning a new system, right, can be challenging for anyone, especially as we're kind of starting to emerge from this pandemic and just kind of a wild, hard year and a half in lots of ways, right? Having another thing to kind of learn and change, I can understand why folks could potentially be hesitant to do that. And finally, SAMHSA, who are the funders of SOAR National and SOAR, all the kind of programs that trickles down nationally. We do have to wait for any changes that we want in the OAT system for those to be approved by SAMHSA. And as many of you know, because you work with Social Security, who we love, federal systems are slow to change, right? And so when we want to do things like add more demographics, right, to the database system, it takes going through kind of the bureaucratic system at SAMHSA to change those things. So those are some of the cons. However, I think that there are more pros, and I want to tell you what those pros are and kind of why we decided to move forward with it. One is that though it is change and change can be scary, I think the actual questions that they're asking in the database are incredibly similar to the outcomes that you have been submitting. They really are not different questions. It's like, was this person approved for SSI or SSDI? How much money? How old was this person? Very, very similar questions. So in that way, I think it will be kind of not a very high learning curve. We also will better be able to track housing, employment, Medicaid, and other kinds of aid that come from the state, which will be really helpful to me and to other folks who are trying to develop positions to say, hey, look, because of this SOAR case, we got over $100,000 in a Medicaid reimbursement, right? And so that's a great reason for you to have another position funded. It's going to make TA stands for technical assistance there. So it's going to make it easier for me to do some training in technical assistance because I'll be able to more easily see where folks are potentially struggling. I'll be able to see with a quick snapshot, are most folks submitting medical summary reports? Are most folks getting co-signatures? Things like that. And we can really kind of target, and I hope those of you, I'm not a gotcha kind of person. I promise I will not be mean and I will not target you in any way, but it will help us kind of see the overall trends in our data across the state. In addition, the data is just going to be more accessible, right? I talked to you about how you will be able to see your own individual outcomes. If you're a supervisor, you will be able to see your supervisees' outcomes, and it won't kind of all live with me, kind of safeguarded and gate kept. It will really be accessible to folks, which I'm really excited about for you to be able to use your own data. You all who are submitting cases can also use it as an organizational tool to keep track of your cases. I know now sometimes folks will email me periodically and there's no record when you send in a fax to me, right? And people will say, I can't remember which ones did I send in to you, which ones did I not? It'll all be right in the system there for you. You can even use it, right, as like a report for your supervisor if you want to. Here are the cases that I started working on this month. Another pro is that the data is just more secure, right? Living in a database that SAMHSA and the SOAR TA Center manage is much more secure than just having it on a giant Excel sheet. And finally, we get tons of really strong support from the National TA Center, from Sumitra and all of her colleagues. They have IT support for anyone who's having trouble getting in or having trouble seeing things on the database. They have a whole user guide that walks you through how to do different reports. There's really a lot of support that comes with it. So I hope I've convinced you that though there are some cons, and I want to be honest about that, I do think the pros really outweigh this. And that's why in the next couple of months, we are going to transition into this new system. Before I hand it over to Sumitra, does anyone have questions, reactions, comments, thoughts?
I think we don't know what we don't know yet. I don't know what question.
That's totally fair, Jane. Yeah, absolutely. It may take kind of seeing Sinitra walk us through it before folks have a question, or even potentially longer, being able to actually work through it yourselves. That's fair. All right, well then I will hand it over to Sinitra. I'm really excited to see this presentation.
Great, thank you so much, Sarah. Sarah, you really did a great job of walking through what some of the pros and some of the cons are with switching to a new system. And so I just want to let you all know, though, yes, it can absolutely be frustrating kind of having to start over, not start over, but move on to something new. Like Sarah stated, I really think that using this new system is going to have a lot of pros for you all. I think that it's going to give you a lot more access over your outcomes. I think that it's going to make TA easier. I think that overall it's going to be a very good transition for your state. And so I wanted to take this opportunity during this training to really give you guys a good walkthrough through OAT to see how the system works in terms of A, entering applicants, and B, also in terms of what you now have access to in terms of your outcomes and your reports. I know Sarah has done a really good job over the past couple months, like slowly introducing you guys to it. So some of this might be things that you are familiar with. But if there are any questions at all, again, like Sarah said, you can feel free to put them in the chat box. You can chime in. I have no issue with that. Can I just get a quick verbal confirmation that you all can see my screen? It should say OAT Works, online application tracking. Perfect. All right, I got the dual screen live, so I'm like looking over to like see your guys' reaction. Awesome. Okay. So first and foremost, I think we talked about this on a previous dialogue call, but the first thing that I want to make sure that we mention before we even get into the walkthrough is that OAT stands for Online Application Tracking System. And the thing that you guys need to remember is that this is primarily an outcome tracking tool, right? So this isn't necessarily a case management tool where you're tracking other data or progress for the client. It's not a system that's linked to HMIS or SSA systems where you're tracking the progress of an application. This system is strictly for tracking an outcome, right? So when you have a decision on your application. I'm going to put the link to the site in the chat box. If you don't already know it, it's soartrack.samhsa.gov. And I'll put that in the chat box. I'd like to see it as we're going through it. And so the good thing about OAT is that it's free, it's easy to use. I'm going to walk you through entering an applicant, but ideally when you are doing this on your own, it's probably going to take you between 3 to 5 minutes to enter that applicant. It's very user friendly. There's nothing to download. It's not an app. It's accessible from pretty much any web browser. So my recommendation is that as you go to register or as you go to the site or you go to the link, I would suggest bookmarking it right there on your computer. So that way when you're ready to track an outcome, you can just log right in and do so. Okay. All right, so let's get started. So first things first with OAT is that you'll need to register. And so when you click the link that was provided to you, this is the screen right here that you are taken to. So as you can see, generic login screen. If you don't already have an account, you're going to click here to create one. And it's pretty simple in terms of the different demographic information that they're asking you. Primarily your name. It's going to ask you to create a password. So one thing to keep in mind here, so where it says role, this is kind of what Sarah was referring to in terms of what your role with SOAR is in North Carolina. You can select different levels. I believe most of you on this call are at the caseworker level where you have access to your own outcomes and reports. There may be some local leads on here, so they would have access to all the data from within their county or city or whichever area that they are a local lead in. Some of you may be agency leads on here, right? So maybe you supervise others at your agency who do SOAR applications, or you're in a role where you would need to pull data, all the data from within your agency. And then of course there's like a state lead level, which Sarah is, where she can pull she has access to everyone's data. Okay, so down here, this little part right here sometimes can confuse people. So the main thing here, it's asking what SOAR trainings have you completed. And the reason for that is because individual can only get approved for OAT registration once they have completed the course. So that's why you see here they're asking about, have you passed the adult curriculum or the child curriculum, or if you've done a leadership academy or whatnot. So whichever one that applies to you, which most of you have passed the course, you would just put, your certificate date on there. If you aren't completely sure of it, you can feel free to reach out to me. I can get it for you, or you can estimate. We're able to quickly just search by your name. So if you're not sure of the exact date, that is okay.
And
So of
just if
course,
I can
yeah,
add
go
one
ahead,
quick
Sarah.
thing to that, Samisha, for those of you who haven't done the online course and have only done the 2-day training, if you don't remember when you completed that, you can email me and I have everyone's records.
Yes, very good point. Thank you, Sarah. All right, so once you've got your login, you've got your account registered. Typically, Susie, who's our OAT administrator, she approves them usually the same day. So once you've got your login ready, you just come to this screen, you're gonna log in. I'm using a practice account so that I can walk you through how to enter. Okay, so once you first log in, this is the dashboard that you see. And I want to just kind of quickly point out some of the things that you're able to quickly have access to upon logging in, right? So again, like Sarah had mentioned before, unfortunately, the outcomes that you already have, they can't necessarily be integrated or moved in here. So when you first initially log in under my initial outcomes, you may not necessarily see numbers there, right? You won't really see them until you start entering them for this new fiscal year. But generally speaking, right, this is your dashboard. So as you can see here, you get a really nice snapshot of kind of where you are. So once you start entering applications, you'll be able to see the number of approvals and denials you've gotten, the number and the percentages of approvals, the decisions, the average number of days. And what's really cool here is that you can kind of compare your statistics to your state statistics. So here in the dashboard, obviously it's YY for a fake state, but for you all, it'll say North Carolina and it'll have your state average there. So you can compare your averages to your state averages and to the national averages as well. So when I was primarily doing applications as a caseworker, I always loved that function for some reason. It kind of helped me stay accountable. So from there, you've got your monthly snapshots with new applications this month, approved applications. And as you scroll down a little bit, you can quickly kind of see what applications you have currently pending, which is this screen, right? So it gives you a quick snapshot of like the type of application, what the status is. So like, for example, some of these are new, some of them are pending, right? And then if you wanted to see all your applications, regardless of whether it's pending or not, you click here on all apps. And again, it gives you a nice little snapshot there, right? So you can access all that quickly from your dashboard. If you want to see a little bit more detailed information about your applications beyond just this tab, you can also click up here where it says applications. And again, and that's where you can, click on it and you'll get like a nice full overview of it. Okay. So that's what's accessible from your dashboard. Oops, let me go back to dashboard. There you go. Okay. So this is all acceptable for your dash. This is all that's available to you on your dashboard. So now in terms of, let's say, okay, you've got a new referral, you've got a decision, and you're ready to enter in a new applicant. So we're going to walk through how you create that. Now, I know this has also been a topic of conversation on previous dialogue calls as well, but in terms of creating the applicant ID, you yourself are going to create that ID for the applicant. It's not an automatically generated one. It's something that you are going to create yourself. And the required format, and it tells you here, right here, it's 2 letters, 2 numbers, 2 letters, and 4 numbers. So you yourself can create whatever numbers it is or combination it is that you would like, as long as you are following that combination. The key thing here is you want to make sure that you are recording somewhere what that applicant's ID is, because the OAT system it's on a secure server. There's no and it's what makes it HIPAA compliant is that there's no personally identifying information being collected from that applicant, right? So again, you can kind of come up with their applicant ID following that format, but you want to make sure that you are recording it somewhere, because you're the only one who's going to know it, who's going to have access to it, to be able to come back to that person. Okay, so let me just make something up here. Just use type. We'll say 7 EO. I'll use my birthday, right? So something like that. And you just hit on create applicant. So once you do that, as you can see here, there's about 5 different tabs. And now the key question that we often get here, right, is, so when exactly do I know when to create an applicant ID, right? Like when exactly do I go in here and enter somebody? Because like we talked about, OAT is an outcome reporting tool, not necessarily a case management tool. And Sarah, feel free to jump in if you have a specific preference for how you want the state to do it. But generally speaking, so there's usually two ways in which people do it, right? So some people like to come in and create the applicant ID once they've set the protective filing date. And again, once you create that applicant, it brings you to this screen where you've got basically 5 steps that you're going to enter information in. Now, you don't necessarily need to do all 5 at one time, right? Like you can enter one tab and then stop, and when you get more information, go to tab 2 and tab 3 and tab 4. And again, I'll walk you through those tabs, don't worry. But so some people like to kind of do it step by step after they've created the protective filing date. However, the other way that people do it, and this is typically the way that we recommend, is some people don't go in here and create an applicant ID or enter any information until they've received a decision, right? So until they have received either an approval, an initial approval, or an initial denial. And again, the reason for that is because, again, this is an outcomes reporting tool, right? Not a case management tool. So by waiting until you have an actual decision, that most likely is going to alleviate some of the issues that comes with, okay, like this application isn't going forward anymore, I've got to delete this person, or having to come in and make changes, make edits because things have changed. Do you know what I mean? Like for some people, just to make the process more simplistic, they wait until they get that decision, that initial decision, and then they come in and just knock out the outcomes reporting part right then and there. And again, like I'm going to walk you through this, and as I'm walking you through it, it's probably going to seem longer than what it really takes, but in all actuality, it would take you about 5 minutes to create that applicant ID and go through these 5 prompts. With that in mind, Sarah, before I move forward, do you have a preference for how you want that done, or do you prefer, or are you going to leave it up to them?
Yeah, I think whatever workflow works for y'all. I think when you put things in as you're going, I know sometimes, like Sumitra said, people will like forget to come back and complete the outcome, or maybe it's somebody that you don't go through with. And so I definitely see the benefit of waiting till the end, but if it just works in your workflow to go ahead and enter it, I don't have a problem with that. Yeah.
Okay, perfect. So either way, whichever works for you. Okay.
Question.
Sure.
If Sarah just said, if it doesn't work out, you don't finish that for some reason, the patient moves away, dies, whatever the situation is that just in limbo then? It's incomplete, or do you go delete everything, or how does that work?
Yeah, good question. And I will, so there's actually a button or a prompt for it when we get to the like tab 4 where it's asking for the decision. It's going to prompt you. There's like a prompt there where you can indicate that the application didn't get submitted or completed, and you can choose the reason. So when that happens, it's not in limbo. It's still recorded in there, but it's not being counted like as part of the state's outcomes, if that makes sense. You know what I mean? Like it's archived that it was started, but it's not counting like as part of your state outcomes. Did that answer your question? And I'll make sure I point that out when I get to the tab.
Yes, ma'am. And one other thing, you have a wonderful voice, but at the end of your sentence, you trail off. I wear hearing aids, and it's just a tad bit difficult to get every word.
Okay, do you want me to slow down a little bit? I talk really fast. So
yeah, you do.
I'll slow it down for you.
I listen slowly.
No worries, I will slow it down. I do talk really, really fast. All right, great. Okay, so you've got your referral, your applicant. You've created the applicant ID. So once you hit submit, create applicant, it brings you to this page. And this, as you can see here, there's 5 main tabs that are part of this outcome reporting process. So this first tab here is just collecting some general demographics on the applicant. So first thing you're going to notice here, well, 2 things that I want to point out. So some of the questions are starred, right? Like any general application. Some of the questions are starred. Those are the questions where the information is mandatory. Some of them are not starred, right? So if you are unsure about the answer, or you do not know it, or if there's questions on here that your agency doesn't necessarily track, so you wouldn't know, you do not have to enter them, okay? Only the ones that are starred. And as you can see here on this initial page, the demographics, almost all the questions are starred. But you'll see on some of the other tabs that not all of them are. The second is, if you're ever a little bit confused about what's being asked, or one of the questions is confusing you, we've got these little information buttons. As you can see, like if you click on it, or if you just hover over it, it'll give you some info, right? So for example, under gender, select the gender that was indicated on the SSA forms, right? It gives you some guidance on if there's an individual who identifies as transgender or non-binary, right? So again, like if you just have if you're a little confused, or if you need a little guidance, you can feel free to hover over those little information sections, okay? So let's walk through and create like an applicant. So let's say we've got a female who is 45. And as you can see, like depending on, oh, sorry, something else I'm going to point out. So the system is very intuitive, right? So depending on what answers you put in, some questions are going to pop up, some are going to disappear, right? So for an adult, the question about military service pops in. But let's say that I was doing a child applicant, right? So if I say age 16, you see how it doesn't pop up, right? So the system is very intuitive depending on the answers that you're putting in. So we have an adult applicant, so it's asking about military service. I'm hitting no. If I didn't know, I would just hit that I didn't know. It's asking, were they receiving any kind of public assistance or other benefits? Of course, you can select multiples here. Just hold down the tab. Let's say she was getting public assistance. Was she working during the application process? We'll say no. The applicant's housing status at the time of application. And you know, when you click the little drop down, there's a multitude of different options here because as we know with SOAR, we serve individuals that are both experiencing homelessness and at risk. So there's a myriad of options here that you can select. We'll say outdoors. And the length of time that's homeless. So you want to enter the length of time that they were homeless prior to beginning this application or whatever their current housing situation is, right? And of course, while we want the information to be as accurate as possible, if you have to, you know, estimate this, right? Or even just if you're going by the client's self-report and they're not completely sure, it is okay. No pressure. It's okay. So we'll estimate, say, a year. Okay. So now, once we've got to the bottom of this form, so as you can see, it says save and continue, right? So once you've finished a section, it's going to it's going to automatically save once you hit save, right? So let's say if your workflow, if you're the type that you want to enter piece by piece, you could stop right there, right? You could stop right there. And then once you're started the application, then you can come back in and fill out section 2, which we'll go through, right? So again, whatever workflow works for you. But once you finish the section, you hit save, it'll save it for you and you can come back and click on it and finish it. And how you would come back and click on it is when you're on the dashboard and you saw the applicant IDs, you would click on their applicant ID. Okay? All right. So once we've entered in those basic demographics, we're on section 2. And this is where we are entering in what type of application was it. Now, the most common type that we'll probably recognize is the initial SOAR application, right? So this is somebody that was referred to us, that we helped them through the entire process. This could even be somebody that maybe started with someone else, right? Or maybe they themselves went down to Social Security and maybe set the protective filing date or started it a little bit on their own before they got referred to you. That's okay, right? It still falls under initial. As long as there hasn't been an initial decision on it, you can track that under initial SOAR application. The other options here would be, you know, if the person's gotten a denial and they're coming to you for help with an appeal, that's when you would then start off with either the reconsideration or the ALJ hearing, right? So again, the point I want to get across to you here is that choose whichever type fits the person's circumstance. You don't need to necessarily start with initial and go through all 4 of these. Whatever situation the person was in, or in whatever capacity you're assisting with, that's the one that you're choosing to fill out. One thing I do want to point out here, this 4th one, this is if somebody wants to choose this application. So if somebody was if somebody was assisting someone with applying for benefits, but they weren't necessarily using the SOAR critical components, or maybe it wasn't necessarily someone who met the eligibility requirements for a SOAR application, they could track them here, right? Now, with that said, you do not need to track non-SOAR claims. It is not required. You don't need to do so. This is just for, we just added this on for individuals that maybe just wanted to track all of their applications within like one system versus having to use 2. But again, you do not necessarily need to track non-SOAR claims unless you just have a desire to, or it's easier for you, something of that nature, okay? So let's say that our practice applicant here, let's say we're doing an initial application for her, right? So I'm going to click start application. And so primarily what you see here, it's asking about the critical components, right? Like it's asking, did you do a 1696? Did you collect the medical records? Did you do this and this and this? And when you're filling out, you know, this section, again, please feel free to be as honest as possible, because again, like Sarah stated, this is one of the benefits of this system is that, let's say some of the numbers started going down, or maybe Sarah, you notice that there's a certain agency where the numbers are a little bit lower than what they used to be. Sarah can come in here and pull data and be able to see, okay, well, I'm noticing that, you know, the medical records aren't really being collected. Or the 1696s aren't really being collected, right? So it allows Sarah to be able to target what kind of technical assistance somebody might need to be able, so she can best support you all, right? So let's say our protective filing date was March 10th. Let's say we did this, we did this, we did this. Let's say it wasn't signed. All this good stuff right here. Now, as you see down here, because again, remember, you can save. So sorry, let me back up a little bit. So let me know if this gets a little confusing. So in each of the sections, when you're done filling out the information, you can press save and continue. It's going to save whatever section you're on, and it's going to bring you to the next one. Section 3 is the only one where you can save and go back to the dashboard. You know what I mean? Like, even if you didn't answer all the questions. So the other ones, you got to answer all the questions, then you can save and continue. Section 3, you could technically like save it without answering all the questions and go back to the dashboard. And that's because if maybe you're working on it and you didn't get a chance to do something yet, it allows you to then go back in and change it to like yes or no. And then down here, I can't remember who asked the question. I believe it may have been Jane, but when she was saying, has a complete application been submitted to SSA? You know, you could select yes. And then of course, then you're going to put the date that it was submitted and all that. But if it's a no, it's asking why, right? So did the person move? They just went MIA, incarcerated, they withdrew, maybe they're at a new agency. But so that's where that question is. Okay. And again, and let's say like, you know, I'm not, I haven't submitted the application yet, right? So I'm saving it. I'm just going to go back to my dashboard. And then when I'm ready, I can log back in, click on the person's name, and it'll bring me right back here. And I can change that to a yes. Constitutive exam, no. Okay. So I'm going to save and continue after I put in the application date. All right, so now step 4. So one thing I want to put out about, I want to make sure I mention for this step. Once you enter in a decision here, right? So once you enter that there has been a decision and you fill in the decision date and the approval date and you press save and continue, you can no longer go back and edit that. Now, that doesn't mean it's not editable at all. It's just that you yourself cannot log back in and edit it. And that's just to protect the integrity of the data, right? So if there was some kind of a mistake there or something you need to change at that point, you would need to contact like Sarah or myself. We can edit that for you, but you yourself wouldn't be able to, okay? So another thing about this section, right, is so one part that trips people up here is that, as you all probably know, with SOAR, we help individuals apply for SSI and SSDI. And oftentimes, like if a person doesn't necessarily qualify for SSDI, they get the denial letter pretty quickly, right? While the SSI is still processing. Make sure that you don't enter in a decision here until you get a decision for both of them, okay? Because we've seen before where people get the denial for the SSDI one, not necessarily the SSI one, but the SSDI one, right? And so they come here and they put that, you know, it was a denial. So you want to wait to get an answer for both, okay? So let's say if it was a yes, let's say that we got that decision on the 18th. Let's say that if it's an approval, again, you could see the prompt here was an approval for SSI and SSDI. You could put whether it was SSI only, SSDI only, or both. Or if it was denial, if it was a denial, put the reason for denial. So let's say that she was an approval, of course, right? And let's say that she got SSI only. So here again, too, like you could put in that the case is still pending, and then also too here unknown. So like if you're not, so if the person again like did go MIA, or if they withdrew, or they got a new representative or whatnot, if there's some kind of situation where you did submit the application to SSA, but there's a situation now where you're not going to know the outcome, then you could click unknown here and again put the reason. And again, like I stated before, that just archives it. It's not counting towards your state outcomes or whatnot. It's just archived. The information there is archived. Okay. So we'll say yes. We'll save and continue. So the last step here is it's just talking about, it's asking about some post-decision outcomes, right? So the only required question on here, I believe, is like the award per month. And I put that she only got approved for SSI. So that's why it's only asking for SSI. So set benefit rate, we'll say she's getting $794. If for some reason that you're with an agency that doesn't track or doesn't wouldn't know that outcome, you can click here, value not tracked. Sometimes some individuals will put 0 here if they're unsure, but you don't want to put 0 there because that makes it seem like they got awarded $0, right? So you can just put value not tracked. So that's the only one on this page that's required. As you can see here, though, the other information here that's tracked is really, really good information to include if you know it or have access to it or the client knows it, right? So asking about Medicaid reimbursement or general assistance reimbursement, what was the person's retroactive back pay? Are they working at the time of decision? Were they housed at the time of the decision, right? And again, it's very intuitive. So if I click yes here, it's asking, did access to benefits facilitate the housing? And down here, the last step is you want to estimate how many hours it took you to complete that claim. And again, you can estimate. We recognize that you're probably not marking every 15 minutes that you're working on the case, right? So again, enter in the information that you're aware of, and then you just click complete application. Computer's going slow, sad. Oh, there we go. Okay, and once you click complete application, it just kind of takes you to an applicant overview where you can just, quickly glance and see some of the key information and key timeline dates from that case. And you can see that at any time if you go to applications and click on an applicant's ID for anyone who's been approved or denied, and you will get like a nice little applicant overview like this. So I do want to show you guys just really quickly, I won't go super in depth, I'll show you guys some of the reports that you can run for your own outcomes. But before I do that, is there any information or anything I need to walk back on in terms of like entering an applicant or any of the tabs?
Hi, can you hear me?
Yep.
Hey, this is Melissa in Charlotte. Hey,
Hi.
I was gonna ask you a question, so and hopefully you didn't go over this, I just missed it. But
It's okay.
if it's a denial and you've recorded that, in here in OATs, and I just submitted the appeal information that was, for the appeal for the patient. So on the previous one, or do I need to add another entry for the appeal? Is it a different entry, or I don't go back on the same patient's application or applicant overview thing, like the making sense?
Oh, I get what you're saying. Like in tab 2, would you click back on there and then click on appeal instead of initial, right? Is that your
But
question?
yeah, I'm wondering because I'm in here now. What you were going through, I was looking and I have it open. I see where I put the denial in, but I don't see. Okay, I see an edit review button under initial SOAR application post denial.
Yeah.
But
So what you're going to want to do is you're going to want to click on change type when you get to step 4, and then you're going to want to click on I think it's ALJ, not appeal, but it says ALJ, and then you're going to enter the data on that one.
okay.
And actually, I like that you brought up that example because that's kind of like a good example of when people like why some people like to wait until they get like a complete decision or whatnot to go in and enter. And I'm not saying you can feel free to go in and enter completely okay, but for many people that's why they like to just wait until they've got like their final answer for the cases.
Oh, got it. Okay, so
But you don't have to.
do not add an extra entry. Go back to the one that we have,
Right.
and then we can update that to whatever the next
Yep.
is. Okay, got
And
it.
if you need like further questions, if you have further questions about that, I can help you with it too after.
Okay, thank you.
Yeah, no problem. Any other questions in terms of entering? Okay. So really, really briefly, because I do want to leave some time for questions and whatnot. So as you're looking up here, if you see reports here, if you click on that, there's 2 different types of reports that you can run for yourself or for your agency or for whoever needs it, or if you're just curious. So one of them is summary. And what the summary report is, it really runs a nice, it just pretty much paints like a pretty little picture of your outcomes for you. And as you can see here on this screen, you can filter specifically whatever it is that you're looking for, right? So if I only wanted to see veterans, or if I only wanted to see children versus adults, or if I only wanted to see my outcomes for those that are living outdoors, or if I only wanted to filter by decision, by date of decision. And as you can see here, right, like you can do this month. Well, you can customize whatever date you want, but there's also quick tabs. You can do this month, last month. You could do this fiscal year. So remember the fiscal year for SOAR. Well, it's the same for you guys. It's July 1st to June 30th. Or you can do last fiscal year, again. But just kind of keep in mind, like, that you choose what dates you want, because otherwise it's going to give you all your data from like 2000 up to 2021. Okay, so here let's do this fiscal year. And so I click filter. And as you see down here, it runs a really nice little report for me that I can just quickly glance at and see. And if I wanted to export that summary, I could do so. It exports through Excel, or if you needed a PDF of it. So nice and easy. And then another, so aside from the summary report, which is, all of your outcomes, you can also do a specific individual report. And this would be like if you specifically want to know about a specific applicant, you could filter and run those reports as well. As you can see, it'll table it for you. Okay, so that's the main thing I wanted to show you about the walkthrough. Aside from that, I just wanted to point out like two, I like to call them FAQs, frequently asked questions, because we know that in our field, unfortunately, turnover is a huge thing. And so a common question that we get is like, if you are taking over a claim from somebody else's, like, how can you indicate that in OAT? So like if somebody was originally working with somebody else, like how can they get transferred to you? How can their claim already get transferred to you in OAT? And so the answer to that is you can just email us. I'll put our email in the chat box, or you can reach out to Sarah, who can reach out to us, and we can switch like that person's case over to you. The one thing to remember here, so like cases within OAT are tied to the agency versus the caseworker, right? So on the flip side of that, let's say that you're doing SOAR at your agency, and let's say that you leave and you're doing SOAR at another agency, you would need to re-register for OAT under your new agency, and you yourself wouldn't necessarily have access to go back into your old agency account. It would still be there, but it would be deactivated where you can't log into it. If for some reason you did need data from your previous account, like for example, if you want to show your good outcomes or all the good work that you've done, or you just need it, we can still get it for you. You'll just have to reach out to us and we'll get it for you. And again, like a big part of that is just protecting the integrity of the data. But so that's how that works. And again, often another question is like, I know we went over it, but a common question again is like, what can be edited versus what can't be. So everything on tab 3 can be edited. Once you've entered a decision, remember that's tab 4. Once you've entered a decision, that can't be changed. And the stuff on tab 5, so like the post-decision outcomes, that can actually always be edited. So you can actually always click back into a person. So click on an agency ID and go back and edit that actually. Oh, shoot. There we go. Okay. So I think we'll open it up for questions. And before we do so, just some general like next steps, and correct me if I'm wrong, Sarah. So typically going from here, what you would want to do is register for OAT if you have not already. We are going to send you the OAT user guides and reports guides, which pretty much goes over everything that I just went over, except it doesn't talk as fast as I do, so it might be easier. And like Sarah stated, July 1st is when you would start tracking your SOAR assisted application. So you don't need to track, correct me if I'm wrong, Sarah, unless you do want them to do it. You don't need to track any that you are doing now, right? Like even if it's June 30th and you started an application there, you don't need to track it until July 1st. Any application starting July 1st.
Correct, unless you are in Mecklenburg County and you all have been using the system. But yeah, everyone else doesn't have to do it until July 1st.
All right, great. So, I mean, if it's okay with you, Sarah, I think we'll open it up for questions. I'll stop sharing my screen.
Okay, so if you haven't put anything in the tracking to this point in this year's cycle, you're saying, can you still do that? Or in July 1st is the new year?
Right.
Sorry, go ahead, Sarah. Yes, July 1st is the new year.
Yep.
And that's when you would start tracking.
So
So
nothing you've done now is going to count.
Well, it still counts. Oh, sorry, Sarah, go ahead.
No, I'm sorry, we keep talking over each other. I was just going to say, so any outcomes, if you get a decision before July 1st, please submit them the old way to me, so through fax or email. If you get any decisions July 1st or after, please put them in the OAT system. So it will still count, as in I will still have them and I will still put them in the monthly reports, but you won't see it show up in OAT, in the OAT system. Does that make sense?
Yeah. Yeah.
Thanks for that clarification. And we had a question in the chat. I registered for OAT before. Do I have to re-register? You shouldn't have to re-register, no. I know, Sumitra, there were a couple where it was folks from different counties who had registered inadvertently. There's nothing they have to do to like turn their account back on, right?
No.
Okay. So you should be all set.
Hi, Sarah. Hi, Sumitra. This is Beth.
Hi, Beth.
Hi. I know we have talked about this on some previous call, and I'm not sure if I missed it on this call. We don't have to start putting anything in OAT until we get a decision. Is that how that works? Or do we, once we start an application, we put the person in the system?
Yeah, so it's up to you, to be honest, like whatever works for you. So our recommended best practice is that you go in and enter it once you have a decision, and that's only because you can go in and do it all in one swoop. You most likely don't have to worry about doing a bunch of edits if changes occur or if the person goes MIA. Do you know what I mean? So that's what we recommend. But if you prefer to go in and do it step by step, some people are just really organized like that, feel free. Whichever one works for you.
That would not be me. I would. I'm
Me neither.
gonna do it the recommended way. Okay, thank you.
Mm-hmm. Any other questions? Any initial thoughts? If you're comfortable saying so, is anyone still feeling a little hesitant about it?
Definitely hesitant, but we're gonna move on forward. We're gonna be positive.
I appreciate that attitude, Melissa. And like I said, we'll send out the SOAR user guides. You know what I mean? Like the written guides, which might be easier for you to walk through. And in all honesty, and if you want to walk through it one-on-one, like I'd be glad to do that with you.
Thanks. I'll let you all know. I appreciate it, ladies.
So I have a quick question in regard to when you're registering and it says role. I'm not necessarily a caseworker. I'm a program coordinator. So should I just still choose caseworker? And I'm the person that will be doing SOAR here at the hospital.
Okay, you said you're the only one that's going to be doing it.
Yeah.
Okay, I mean, I'll defer it to you, Sarah, but I would say like if you wanted, you probably could do like an agency lead or do a caseworker. I mean, if you're the only one there, you don't really have to do agency lead. That would be if you were seeing other people's data, but you could do caseworker.
Okay, thank you.
Mm-hmm.
And I do know there were some folks in conversations with them who said that their supervisors or programs might have questions about OAT, especially I think folks who work in some of our healthcare settings. Sumitra did say, and I just wanted to highlight that the OAT system is completely HIPAA compliant because there's no identifying information in there. It's just an app ID. It doesn't use folks' names or birth dates or anything like that. But if anybody has concerns about that, I am totally happy to talk to programs or supervisors and allay any of those fears.
Right, great. Sarah, do you already have like the user guides downloaded, or do you need me to send you those?
I have them, yeah, so I'm happy to send them out. What I'll do is I'll send out a follow-up email and I'll include the link to the recording. For anybody who had trouble, because I think Sumitra and I both talk softly and talk quickly, you'll have access to the recording, and GoToMeeting actually has a transcript function, so you'll be able to actually see what we said. It is kind of auto-generated, so it might not be perfect. And I apologize that we didn't use a platform that has closed captioning. That's a really good thought for the future, to look into other platforms that might have that. But we will definitely have a recording and transcript and some of those other resources that Sumitra was talking about, like the user guide.
Yeah, on a lighter note, you could just talk Southern and slow down.
I will work on it, I promise. I'll have to mimic my mom's accent. She's from Atlanta, so.
I'm a Southerner and I speak very fast. Unfortunately.
All right, great. So yeah, I will put my email in the chat box as well if anyone does have any other questions.
Great. And I saw somebody unmute, but I don't know if that was an accident. Somebody wanted to say something. Jennifer, I see you're unmuted, but we don't hear you if you're saying anything. Just in the interest of time and not keeping folks, Jennifer, maybe if you'll email me, I'm happy to follow up. But thank you everybody for participating, and we're in it together. We'll learn the system together. I think it will not be as scary as it seems, but it definitely takes. Oh, okay, great. Jennifer had a suggestion about another platform that has closed captioning. Thank you. I'll look into that one.
Oh.
Awesome. Well, thanks so much, everyone. Great
Have
to
a
be
wonderful
with
day.
you.
Thank you, everybody. Thank you, Sarah.
Bye.
Thank you.
Thank you.
Have a good day.